So this is going to be the demonstration for mini labs number 2, 3, and 4, which are head, neck vessels, eyes, ears, nose, mouth, and throat. Excellent. Okay, you ready?
Ready.
Wash my hands. Good morning. My name is Ginger. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Kata White, 2/15/1980 something.
Okay, excellent. I'm just going to pull this curtain for privacy. And so I'm here today to do an examination of your head, eyes, ears, nose, throat, and neck. Do you have any questions about that?
No.
Okay, excellent. And I have my equipment ready for me to be able to perform this. So can I give you this gown, please? Okay, so are you having any pain overall right now?
No.
Wonderful. And do you have any headaches?
No.
Have you had any trauma to your head, any head injury?
No.
Okay. Is it okay if I go ahead and touch your head?
Yep.
All right. So just looking at your head in general, I see that your head is normocephalic in size. And then while I'm palpating your head, do you have any pain or tenderness when I do this?
Nope.
Okay. And your head is atraumatic. Excellent. So now I'm gonna feel right here for your temporal arteries. They are a 2+ regular. So down here for your TMJ. And can you open and close? Maybe a little further back. Go ahead and do it again. Great, and there's no crepitus or grinding or clicking that I'm noticing with that. And then can you, I want you to follow some movements that I do. So if you could smile, frown, puff out your cheeks, and then raise your eyebrows. So that's to test cranial nerve number 7, which is the facial nerve. Okay, great. So moving down to your neck, I am looking, actually I want to ask you a question first. So do you have any pain, or have you noticed any lumps or any difficulties in your neck?
Nope.
Okay. So looking at your neck, I see that it is symmetrical. I don't notice any masses or any lesions on the outer surfaces. I'm just going to palpate your trachea. Great. I'm going to palpate your lymph nodes. So they are preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, deep cervical chain, posterior cervical, and then can you just reach it like this? Great. And this is supraclavicular. Wonderful. I'm just going to come around behind you. Oh, stay. Yep, stay where you are. I'm going to hop up here. Just make it a little bit easier for you to see. I'm just going to do a quick landmark. All right. Could you tilt your head to one side? I'm just going to displace the trachea a little bit and just palpate that lobe. And then can you tilt to the other side? Displace and palpate this lobe. All right, and I do not feel any nodules or enlargement of your thyroid. So that's all good. So let's move on to your eyes. Do you wear contacts or glasses?
Contacts.
Okay. And are you having any difficulty with your vision?
No.
Wonderful. So out of the 3 tests, being the Snellen chart, the Rosenbaum test, or the confrontation test, I'm going to choose the Rosenbaum test for near vision. So if you could hold this in front of you, roughly about 14 inches from your face. If you could cover one eye, please, and read the lowest line that's comfortable to read from left to right.
9377626.
And then if you could switch eyes and cover the other eye.
9377626.
And then if you could uncover, and can you read with both eyes open, but now read the opposite way, since I did not ask you to do that with the second one.
628739.
Excellent. So you are 20/25 with your vision. That's testing cranial nerve number 2, which is optic. All right, so we've done your vision test. Now I'm going to move into some testing of the motor components of your eyes. So we're going to do the 6 cardinal fields test. This tests cranial nerve 3, 4, and 6, which is oculomotor, trochlear, and abducens. So if you can, hold, I'll hold. If you can follow this pen light and don't move your head, just follow it with your eyes. Great, and I don't notice any nystagmus with that. So looking at the outer structures of your eyes, we've already discussed your symmetry and your facial movements, but you additionally have symmetry with your eyebrows, and all your eyebrows seem to be present, and there isn't any patches. Can you please close your eyes for a moment? So looking at your eyelids, there's no scaling or lesions noticed. Your eyelashes are full and intact. Can you open up your eyes, please? Your sclera is white. Can you please pull down like this? And your conjunctiva are, they're pink in color. And go ahead and relax. And then your irises match in color. They are also round. So now looking at your pupils are, you're about a 3. So we have a pupil size of 3 millimeters. They're also round in size, symmetrically. And now to do your reaction. Direct and consensual. And then I have direct, consensual. Good. So she is reacting both eyes appropriately to light. Now I'm going to have her do a reaction or test her reaction for accommodation. So, do you want to stand on the other side?
No, you're fine.
So if you could take a look at this pen, and now look at the wall, and look back at the pen. And her eyes did accommodate, they constrict when going from a far object to a close object. So from the eyes, we're going to go to the ears. Do you wear hearing aids or any other assistive devices?
No.
Okay. Are you having any difficulty hearing?
Sometimes.
Okay. One ear, both ears?
Both ears.
Okay, great. So first I'm going to inspect the external part of her ear. So looking at the auricle itself, from the pinna to the lobule, tragus, mastoid process, I don't see any lesions, discoloration. There's no exudate that's coming from the ear. I'm going to do that on both sides. And same thing, the auricle, the pinna, the lobule, tragus, mastoid, and I don't see any lesions, discolorations, or any drainage. So now I'm going to palpate her ears, palpate them at both at the same time is absolutely fine. Do you have any pain or tenderness while I do this?
No.
Okay. And I also do not feel any nodules, cysts, or any masses under my fingers when I do that. So we're going to test cranial nerve number 8, which is acoustic. We're going to do the whisper test. So I'm going to stand 2 feet away from her. And can you please plug your left ear in this position? Thank you. So I'm going to whisper 3 words, if you could repeat them back to me.
Coffee. Latte. Special.
Okay. And then the other side. And plug the opposite, correct. Plug that ear.
Purple. Yellow. Orange.
Excellent. All right, that's all good. Now let's go to the nose. So with the nose, have you ever had trauma to your nose?
No.
And do you have a runny nose right now?
Yes.
Okay, great. So looking at the outside of your nose, the exterior, external structures, your nose is midline. There isn't any visible lesions or discoloration on the outside of your nose. Can you please place one nostril and plug it and breathe in and out? And then do thing on the other side. And both nostrils are patent, which is great. Now I'm going to look in the inner part of your nose. So if you could just tilt your head back when I take a look. I don't see any exudate, any drainage. The mucosa is pink, and I don't see any polyps. I don't see any bleeding. I don't see ulcerations. So it all looks good. Doesn't look deviated. I don't see anything like that. All right, so moving down to the mouth. Do you have enough sores that I should be aware of?
No.
Okay. So looking at your mouth, your lips are pink. They are moist. I don't see any cracking concerns there. Can you take your upper lip and tilt it up so I can take a look at your gums, please? Great. So the top frenulum is intact and the gums are pink, no hyperplasia or blue-black line noted. Can you then do the bottom? Also, so that frenulum is intact and that gum also pink, no hyperplasia or any blue-black line. Okay, ready to open your mouth?
Mm-hmm.
Okay, so go ahead and open. And when I open this time, I'm looking at her teeth initially. So I'm gonna look at your bottom teeth too. So she doesn't appear to be missing any teeth. Teeth are white in color and they are intact. Looking at the floor of her mouth, that is also pink and moist. Her tongue is pink and moist and rough in texture. Buccal mucosa is pink and moist, and her hard and soft palate are also pink and moist. Go ahead and close your mouth for a second before we keep going. Okay, you ready?
Mm-hmm.
All right. So have you had, because I'm just going to change them just a little bit to make things easier. Have you had any sore throat?
No.
Okay. And have you had any difficulty swallowing?
No.
All right. So now we'll go back into looking at things. So the first thing I have to do is go ahead and grab this. I want you to swallow some water for me. Great. No difficulties. I don't see that you're gagging on that. So that's testing cranial nerve 9, which is the glossopharyngeal cranial nerve. And now we're going to test cranial nerve 10. So if you could open your mouth. You don't need to stick out your tongue. You just open your mouth and say, ah. Excellent. So at the same time, I'm able to see that your uvula stayed midline and your soft palate rose symmetrically. So it's testing cranial nerve 10, which is the vagus nerve. I also, at the same time, was able to look at your tonsils, and you have about 2+ that are sitting there. So in addition to that, the last thing I want to do is test your cranial nerve number 12, which is glossopharyngeal. So could you stick your tongue straight out at me? Great, I don't notice any deviation or fasciculations. And if you could please say these words: light,
Light,
tight,
tight,
dynamite.
dynamite.
Excellent. Well, that concludes my assessment for today. Do you have any questions?
No.
Okay, so your, I didn't find anything abnormal. Your hearing seems to be doing well, even though you're struggling with it. And I'm going to document my findings and let the provider know